Hey, hi everyone. My name is Lily Bindra, and I decided to do my project over the Developmental Coordination Disorder Questionnaire. So, what is the Developmental Disorder Questionnaire? Well, it is a parent-reported screening tool that is designed to indicate and identify motor coordination challenges in young children ages 5 to 15 years old. It does this by assessing functional motor performance in everyday activities, which can help distinguish children with possible developmental coordination disorder, also known as DCD, from their commonly developing peers. The Dcdq has displayed strong psychometric properties with high internal consistency. Its Cronbach's alpha is typically greater than 0.90, and it has good retest reliability and a solid construct validity. So it is very valid and very reliable. Studies have shown that it also associates well with the standardized motor assessments, such as the Movement Assessment Battery for Children, or MABC, emphasizing further its validity. Overall, the Dcdq is considered a valid and reliable instrument for early identification of motor coordination challenges, making it both advantageous in both clinical and research settings. So here is our patient. Her name is Lucy Bindra. She is a 15-year-old white female. She is who we did this Dcdq questionnaire over. And now we're going to see some example videos here. These are some videos of some things that the parent who's filling out the questionnaire might look at and want to think about how their child performs in as they're filling out this questionnaire. Things like catching, throwing, hitting with a racket, overall motor coordination, running, jumping. Also motor behaviors such as writing and drawing and cutting. Again, none of these actions are actually required for the questionnaire, but they are some things that the parent who is filling out the questionnaire would take into consideration on how their child performs compared to other children their age. And here is a video of our parent filling out and using the instrument, filling out the questionnaire. Here is the test response, the response from the parent, from the mother, Jenny Bindra. It shows the child up in the top right corner, the child's birth, age, and today's date to be filled out. And then the different questions. There are 15 different questions. The first one is your child throws a ball in a controlled and accurate fashion. And in this instrument, the parent is to rank this on a scale of 1 to 5, 1 being not at all like your child and 5 being extremely like your child. And the Dcdq asks for the parent to compare their child to other children who are the same age as their children to help with the accuracy of the test. So here we can see that Jenny has ranked the patient as a 5 for throwing the ball in a controlled and accurate fashion, catching a small ball, hitting and approaching a ball, jumping easily over obstacles found in a garden or play environment, running as fast or in a similar way to other children of the same gender and age. And the child has a plan to do a motor activity, he or she can organize his or her body to follow the plan effectively and complete the task. She is also given a 5 to most other things. The remaining questions being your child's printing or writing or drawing in class is fast enough to keep up with children. Their printing or writing letters and numbers and words is legible. The child uses appropriate effort when printing or writing, no excessive pressure. Your child cuts out pictures and shapes accurately and easily. Your child is interested and likes participating in sports. Your child learns new motor tasks, is quick and competent with tidying up, putting shoes on. Your child does not fatigue easily, and the only 4 that our patient got was with your child would never be described as a bull in China shop, which is quite a bit like your child. And so here is the score sheet here we fill out for the first 6 questions involve control during movement. This next set of 4 questions involves fine motor / handwriting, and then the next category is general coordination. Here we can see that for control during movement, our patient scored 30 out of 30. For fine motor / handwriting, 20 out of 20, and for general coordination, 24 out of 25, giving her an overall score in total of 74 out of 75. As we can see here in the bottom left of the score sheet, because our patient is 15 years old, she scored within the 58 to 75 range. She just probably does not have developmental coordination disorder, as you can see indicated by the arrow. So what do these results mean? For ages 10 to 15 years, as we saw, a score of 58 to 75 has a result of probably not DCD. Because Lucy's score was 74, the survey indicates that our patient most likely does not have developmental coordination disorder. Although the Dcdq cannot alone diagnose DCD, so these results cannot be reported with certainty, meaning that results have to say probably not DCD and does not have DCD. Because the diagnosis is moderately clear, there is no need to report the sensitivity or specificity of her scores, although this is an option if there's maybe some confusion or there's not a ton of clarity. The recommendations for the patient are because the DCD is probably not indicated with this patient, there are really no necessary recommendations. Only recommendation would be for the parent to keep an eye out if any of these motor skills change or if there seems to be a difference with any scores moving forward. Here are some references that I use during this project and with my research, and I hope that you all learned a lot about the developmental disorder, coordination disorder questionnaire.